Hello, everyone. You're welcome to another episode of A Day with Your Fertility Specialist. My name is Precious Adama, and I'll be your host for today. Thank you, viewers, for tuning in. Thank you for your likes. Thank you for your comments. Thank you for your support. We really, really appreciate it. On today's episode, we're going to be talking about fertility after 35, the myths, the facts, the reality. So, this is like a sequel to our last session that we had. If you didn't tune in, you can still go back and watch all the videos. So, to throw more lights on today's topic, we have with us Dr. Jean. Good afternoon, Dr. Jean.
Good afternoon, Precious. Thank you for having me.
Thank you for being on set. I'm sure by now she needs no introduction, but for those joining us for the first time, Dr. Jean is a minimal access surgeon. She's a gynecologist and she's also a fertility expert. So, a triple threat. And we're going to be asking a lot of questions today. Make sure you log in, make sure you reshare to your friends and family so they could be part of the knowledge sharing session. So, to you, Dr. Jean, fertility after 35, the myths, the reality, and the facts. So, basically, for a start, we'll just be going with the myths. That's some preconceived notions that people have regarding the subject. You're going to be giving us true or false answers. Are we ready?
Sure.
So, question one. After age 35, a woman's menstrual cycle becomes irregular. True or false?
Now, false.
Okay.
Now, yes. So I would throw more light. You can have regular periods from any cause after age 35 years, but
Okay.
it's not a fact that every woman after 35 begins to have irregular periods. The
Okay.
challenge there is that you might begin to have difficulties with predictability of her ovulation, tracking ovulation. Thereby, all those can also affect fertility.
Okay.
But age 35 is not a line where you
Yes.
draw regular periods and irregular periods. But yes, with declining ovarian reserve and
Yes.
quality, yes, periods can become irregular depending on other factors that may be coming into play. So, no, that's not a fact.
All right. Not a fact. Noted. So, number two, you instantly become infertile after age 35. True or false?
False. So, a lot of women have gone on, they can have, get pregnant, have healthy pregnancy,
Yeah.
healthy babies after 35 and even in their early 40s.
Okay.
Yes, and for the same reason I explained, but again, fertility starts to decline after 35 because of the
Yes.
ovarian reserve
Reserve.
and all of that. So now there's an increasing fertility challenge after
Okay.
35. So
Yes.
pregnancy rates per cycle is reduced, but it doesn't mean that a woman cannot get pregnant or
After age
after
35.
35. Yes.
False. All right. Noted. Next, age only impacts women's okay, age only in fact impacts women's fertility, not with the men. True or false?
False.
Okay.
Age impacts both male and female fertility.
All right. False. Pregnancy after 35 is automatically too risky. True or false?
False.
Okay.
Yes, so we had explained that women can have healthy pregnancy with good prenatal care. They can go on to have healthy babies so long as the prenatal care is good. Yes, even though after 35, some medical conditions increase, like gestational diabetes, hypertension, increasing miscarriages, and chromosomal abnormalities. But
Yes.
again, you can also have healthy babies, healthy pregnancies after 35.
Yeah. All right. Thank you so much. We're done with the myth section. So before we delve in fully, just want to ask, we always talk about women when we are talking about these fertility issues. So I just want to ask for the men now, are there like significant changes that occur in the male reproductive system after the age 35?
Well, for the male folks, nothing's classic. Yeah, so just like women age and have other structural problems, like they can have abnormal veins around the testicles, they can
Yes.
have surgeries, they can have things affect the reproductive tract.
Okay.
Yes, but commonly for the male fertility, while we're talking about women's air quality and number,
Yes.
we're also talking about for the men, they can be challenges with the sperm they produce, the
Okay.
movement of the sperm, the appearance. So those are the things that can now impact their fertility alongside other structural problems that can come just like you would have for the females. You can have adhesions, repeated
Yes.
surgeries, treatments, and all of that. Yes.
Okay. Thank you very much. Thank you. So it occurs at 35 and above for the men.
Now, for the men, you can take it up to 40. You
Why?
begin to see those changes. Well, it's because at that time now is the aging process. While
Yes.
for the women is depletion of a reserve that we are born with.
Okay.
Yes, a woman is born with all the eggs she could ever have. So
But
you
men
just
born with all this sperm.
they
Remember?
keep producing the sperm,
Okay.
and that is why there's a myth that if a man can keep fathering children until
Yes.
anytime he's ready, but he wants to stop. But that's not always the case. You can also
Okay.
have changes in the sperm quality, just like we have for the eggs, and poor sperm qualities can also affect pregnancy outcomes.
Okay. All right. Thank you very much. It's good to know. So does turning 35 automatically mean that the woman will struggle to conceive?
No, it
Okay.
doesn't. Women would not automatically struggle,
Yes.
but
Okay.
it's a fact that with the decline in your reserve and all because of age,
Yeah.
there's age is this chance of fertility challenges that a
Mm-hmm.
few women would experience. So reducing their rates of pregnancy uptakes and also increasing chromosomal problems with their pregnancy. So yes, some women will struggle, but a lot of millions of women worldwide are having more pregnancies after 35.
All
Yes.
right. Okay. So how do the egg quantity and quality differ, and why are both of them important in fertility?
Yeah, so egg quantity talks about the number of eggs a
Okay.
woman has, which is commonly referred to as ovarian reserve,
Okay.
while the quality talks about the state, how healthy these eggs that the woman has, that the
Okay.
woman have rather. So if a woman has, so some women can have good egg numbers,
Yes, but
but
they
the
are bad.
quality is poor.
Okay.
Yeah, so you see, and both of them have a way of affecting the fertility of a woman.
Okay. So, like, if you have good eggs with fewer numbers, you have high chances of conceiving than with many eggs
With
with
poor
bad
quality,
qualities.
yes, because those are the
Okay.
ones that increases your risk for having what we call chromosomal anomalies,
Okay.
like Down syndrome and all of that,
Okay.
which are
Okay.
commonly seen in older women.
All right. Thank you for that. So, a woman can conceive naturally after 35. You already cleared
Yes,
that up.
yes.
That's very good to know. How common are pregnancies after 35? How common do we have successful pregnancies after 35?
Yes, as common as the number of women that want to get pregnant.
Like 20s and 25?
Yes, just that we have explained that yeah, pregnancy uptake is slower, but
Okay.
again, for most women after 35 can conceive either spontaneously or through fertility treatment. One form of fertility treatment or the other would go along with women over 35. So pregnancies after 35, very common. Even in this current era of women going after careers,
Yes.
business, so relationships come much later. So there's even we see a lot of women now
Mm.
pregnant over 35 compared to when women were more. Now women are delving into every other thing like the men, not
Women in men's
necessarily
field.
not
Yes.
necessarily women at home and just doing the home front like it used to be in the past.
Okay. Thank you. So is fertility decline the same for every woman, regardless of body type? Is it same for every woman out there?
No, it's not. It's not the
Okay.
same. So fertility decline differs for women because you put together the genetics of the woman, if she has medical conditions, her tubal fallopian tube health, the uterine
Okay.
health, fertility status of her partner, and even if she has chronic medical conditions, and if she's gone through treatment for one when if she's been under chemotherapy or
Okay.
so it differs for women because some other women will still go ahead to have pregnancy at much later age. So it's just a genetic thing, not necessarily one size fits all for all women.
All right. That's good to know. The good answer. All right. So if a woman looks healthy, she has her regular periods, does that guarantee normal fertility?
No, it doesn't guarantee. Yes, looking healthy is reassuring, But again, every other factor must be intact. Remember, we said for you to get pregnant, a lot of factors come into play. So looking healthy, yes, reassures you that things might be fine. But when you evaluate a woman, you have to check all the boxes, her tubes, her
Yeah.
uterus, and other things. Yes.
Okay. So does IVF completely overcome all the age-related fertility decline?
No, IVF doesn't, but it increases the chances for a lot of women and or couples achieving their parenthood desire. So it
Okay.
doesn't overcome all the challenges. Remember that with IVF too, if you have poor air quality, that
Yes.
might reduce your success rate, poor sperm quality, all of those come into play. Even the state of the uterus can also affect. What about the
Yeah.
tubes? So a lot of factors come into play. So IVF doesn't necessarily take all of those, but it increases your chance as is a planned, well prepared process. So we take out some of those challenges and makes it a lot the success rate is improved for a lot of couples.
Okay. Thank you. So, are there misconceptions created by celebrity pregnancies and social media stories?
Well, there are social media stories and celebrities they create this false impression that I got pregnant at 45 easily.
Yes,
They
without
don't
any
give you the
IVF
whole
story.
story of what went in the back. Even if went through IVF, they
Yes.
don't tell you about if they don't tell you about donor eggs. They don't tell you if it was a third party kind of reproduction, like we talk about adoption,
Yes.
surrogacy, and all of that. You don't get to see all of those, and that is they create this false impression that things are easy when you get to this point, but
Okay.
that's not always the case.
All right. So, I want to ask, does the risk of miscarriage increase with age?
Yes, when we talk about the health of the eggs,
Yeah.
yes, so when they are not very healthy, like when we talk about poor quality, yes,
Okay.
so it increases the risk of chromosomal anomalies that babies that are not well formed,
Okay.
and sometimes the body gets tries to get rid of those babies on its own. So that's
Wow.
why the miscarriage rate is increased with some of those
Okay. So, you're
things.
saying like a baby with Down syndrome, the body will try to let go of
Yes,
such a
Down
child?
syndrome, sometimes the body accommodates and the baby is born with a lot of challenges in and out of hospital. But there are some extreme chromosomal problems that the body naturally gets rid of them. And that is why first trimester miscarriages are common. The major cause for first trimester losses, which is very common, is
Okay.
chromosomal anomalies. Yes, we don't get to
Okay.
test all of them because if you keep going to do a test, what we call karyotype for all miscarriages, then you
Yes.
pick a lot of that.
Okay. All right. So, are there pregnancy related risks that become more common after 35?
Yes, so after 35 is more like it's like an advancing kind of
Age.
age.
Yes.
So
Huh?
these are conditions that come with age naturally, not necessarily having to do with the woman. But when you're pregnant at over 35, these
Yes.
conditions can also come. Talking about diabetes, what we call gestational diabetes,
Okay.
hypertension, miscarriages, um, having babies with one anomaly or the other, they also increase risk for surgical deliveries by cesarean section and all of that. So
Okay.
most of those things, because if you link them from one medical condition might make the woman in bad state to even try vaginal birth.
Okay.
Advancing age, you don't want to risk pregnancy at that age. A lot of factors come into play, especially when it's a first time mother after 35.
Okay.
Yes.
Okay. Okay. So, for a first time mother after 35, what would be your recommendation? Like giving birth, is it SVD, like spontaneous vaginal delivery, or CS?
No, why if the factors are right, so you every patient or every client is managed individually.
Okay.
So you select your factors. So you look at the factors that favor a vaginal birth,
Okay.
factors that will favor a cesarean section, advise the woman appropriately, and she makes the decision Of course,
Okay.
that will now be an informed decision.
Decision
So
that
she's
she's
coming from a
making.
place of knowledge. Yes.
Okay.
So
All
no, it's
right.
no one size fits all again.
That's true. Thank you. So, what can women do to better understand their fertility status?
Well, basically asking questions, seeking knowledge, you know. Um, then for those that have one gynecological concern, like those with endometriosis, pelvic infections, chronic pelvic pain, they need to ask questions, present early, so they can be directed or
What to do?
advised appropriately on what to do and what not to do.
Okay. So, it's good to always see your fertility expert to get
Sure.
consultation. Okay. So, when should someone seek fertility evaluation or advice? Is there?
Well, yeah, so for women over 35, it's
Okay.
advised that after trying for about 6 months, no pregnancy, should seek medical advice.
Okay.
While for women younger than 35,
Yes.
yes, they can seek medical advice after 1 year of trying and
Okay.
no pregnancy.
No
But again,
pregnancy.
there are women that have some other conditions, heavy menstrual bleeding, pelvic
Yes.
mass, chronic pelvic pain, endometriosis. They don't have to wait that long because
Okay.
all of those gynecological conditions can impact fertility in one way or the other. So
Okay.
it's better they are evaluated earlier compared to than waiting with all those timelines I have
Okay.
stated. But again, any woman that feels she needs to be evaluated, you don't have to wait. If you're younger than 35, you don't have to wait. Keep counting the clock. Okay, this is the fifth month. This is
Mm.
the sixth month.
Yes.
Whenever you feel you need an evaluation, you need to have an interaction with your gynecologist. Any
Okay.
woman's at liberty to have that discussion.
All right. Thank you. So you made mention of heavy menstrual bleeding. How is that associated with infertility? Like, because I know some people actually just feel like their normal menstrual period it's heavy, and they just take it as something that is normal because it has been like that for a while. So it's like a problem if the menstrual bleeding is actually heavy.
Well, heavy menstrual bleeding has common causes.
Okay.
So commonly you would have fibroids. Yeah, so
Okay.
now the location of fibroids can affect fertility. So you have
Okay.
a very large fibroid sitting just underneath the lining of the womb where implantation is supposed to happen. You
Okay.
can have recurrent miscarriages with that, and you can also have the heavy bleeding because that would increase the surface area of the uterus.
Okay.
Heavy menstrual bleeding, you can also have that in adenomyosis, which is the lining of the uterus now finding its way through the muscular layer of the uterus can cause heavy bleeding, pain, and
Okay.
reproductive outcomes for women with adenomyosis too is also significantly reduced as the
Okay.
uterine environment is not it's kind of hostile with that condition. So it's not the outcomes are usually poor compared to the general population.
Hmm. All right. Okay. Thank you for clearing that up. So, what would you say to a woman who is over 35 and worried that she has waited too long?
Well, for a woman over 35 who is worried that she has waited too long, she should stay hopeful. She should
Mm-hmm.
seek medical counsel. Um, Too long can be 1 year for some, can be 5 years for some. So whenever a woman feels she needs to have this discussion, she should be evaluated. You don't have to be worried. Instead of living in fear with all the myths on the social space and all, woman,
Yes.
it's better to come have that discussion to better have an understanding, give the
Okay.
required peace, and plan properly for your pregnancy journey.
Okay. Oh, thank you. Thank you so much. So, what's the most important message you would like the viewers to take from today's discussion?
Yes, so the important message I would want to give my viewers this afternoon. Over 35 is not a deadline to fertility. So a
Yeah.
lot of women can get pregnant, have babies after 35. But as we have emphasized, the challenges with fertility is becomes pronounced after 35, predictability of cycles, and also women over 35. It's this discussion is a guide for so that after 35 time is also important, is
Okay.
also something you should include in your planning. Yeah, so when you're planning, so unnecessary delays should be taken out if you are in charge. Of course, there are some delays that are not made by the individual waiting or over 35. But
Yes.
if you can take off all of those, fine. Then the advice again for women pursuing careers and all, there's an option of freezing your eggs. So of course, when you freeze a younger egg, you can have, it doesn't
Better
mean
options.
IVF, the success rate is 100%, but your options are diverse. So it gives you better hope. And of course, reproductive outcomes get better with options and informed decisions.
Okay. Thank you so much. So I think we'll get to the last question of the day, more like a myth. So they say men are fertile for life on normal circumstances. True or false?
False.
Okay. I wanted to hear that actually. Okay.
Yes, it's false. Yes, even though
Okay.
most men with even advancing age could also father children, but just like we explained earlier, they can also have poor sperm qualities with advancing age affecting fertility. And when that is affected, it means that fertility has dropped for them too, so they cannot be fertile for life.
Thank you so much, Dr. G. Thank you so much for joining us on set. It was actually a very impactful session. Thank you so much. And to all our viewers, thank you for joining us today. I hope we learned something new because I definitely did. Make sure to join us on our next sessions. We do this every Wednesdays and Fridays, as you know. 3 p.m. remains the time. You catch us on Facebook, you catch us on Instagram, on TikTok. So don't forget to tune in and learn more. And also, you can take your fertility journey very serious. Speak to your fertility expert. You should know more about your bodies. Don't just take these sessions lightly. We are giving tips to live by. So all of us should actually take something down and do something for ourselves. Thank you so much for tuning in. Have a wonderful rest of your day. Bye.